Hi everybody, welcome back. Today we're going to be working on some resistance training for the lower extremity. I'm going to go ahead, I always start off with the lower extremity with clients because it's very important to work with the mobility of the hips. So first we're going to start off with squatting. We're going to do overhead squatting because it helps align the spine. I'm going to do a side view and a front view so you can see. If you have trouble squatting or if you have hurt knees, do consult your doctor or your trainer before you start any of this. So if you're looking from the side, you want to start with your hips in a nice athletic position. Arms, palms facing each other over the head. You want to stick your butt out and sit back on your knees, okay? We don't want you to go forward and put pressure on the knees. You want to stick your butt out, sit back on your heels, push up through the heels, squeeze your butt on the top. Make sure your feet are slightly at an angle, especially females, because our femur goes out of our pelvis at an angle because we're childbearing, or at some point we're supposed to be. So you want to make sure your hips are back, feet are angled, pushing up through the heels, squeezing the butt from the front, hips back, push up through the heels, squeezing at the top. If you're looking from behind or working with a trainer or partner, take a look at the hips, make sure nothing's hinging or there's nothing uneven, all right? 3 sets of 12 or 2 sets of 15. After you do the squats, we're gonna go ahead and go into lunging with a wood chop, or lunging with a little bit of rotation. So it's really important to exercise rotational movements with the hips because it's more of a hinge, or it's more of a synovial joint. So you want to make sure that you're moving the hips in rotation. So what we want to do is you want to start split stance. I'll give you a front view as well. Make sure that your knee is lined up with your ankle. You're going to drop straight down. Arms are going to go to the side. Push up through the front heel, up and out to the opposite side. So down, weights in the front heel. Push up through the heel, up to the other side. If you're looking from the other side, down, knees lined up with the ankle, push up through the heel, rotate up, squeeze this butt. The leg that's behind you, you want to squeeze your butt so you stabilize your spine. So once again, down, push up, down, push up. You can do 3 sets of 12 or 2 sets of 15. Lastly, tube walking. It's really important. You want to work your abductor muscles as well as your adductor muscles based on how your foot position is. I find these really good for people to start firing the glutes and the abductors. So these are really easy to find. You can go to any athletic store and they're really cheap. It's tubing or any type of band. So you want to put them above the knee. Don't put them across the knee. A lot of people will put them at their ankle. I like this for beginners. So what we want to do is you want to get in an athletic position. I'll show you from the side as well. Just like you would start a squat. It's kind of a half squat. Hands on the hips, chest elevated to the sky, belly button drawn in. You want to take a step out and then back to your base. It's really important to never go more narrow than your original base. So we don't want to do this. We want to start in our base, squat down, step out and in. Out and in. Okay? If we're looking at a side view, athletic position, hips back, chest up. The lower you go, the more you're going to feel it on the outside. So we're going to step out, out. With these also, you're going to do 3 sets of 12 or 2 sets of 15. Make sure your belly button's nice and tight. If it's not, you don't want to feel that pressure in the low back. Next week, we're going to go ahead and introduce TRX, upper extremity work. So we'll see you guys next week.